Patient Safety Week, it's very important, not only to me, but for all healthcare providers, because patient safety should be our first and most important task as healthcare providers. Providing virtual care has been a very great experience for me. I feel that with virtual care, we can provide specialized care for patients that lives far away from the hospital, or we can also make their life easier so they do not need to travel to come to the hospital. We can also have the family together. We have the opportunity to discuss and to spend more time with the patient. In addition to that, the environment that has been set up here at the hospital, it has enabled us to provide a safe and digital secure care to our patients. So on this pandemic COVID-19 year, I feel that like being able to deliver virtual care has been of great advantage to our patients and to the medical system.
Well, virtual care is one of the most commonly heard terms these days, I think, in healthcare. Virtual care for me could mean telephone contact, the old-fashioned kind of virtual care. It could mean video conferencing with a care provider. It could mean having a patient portal where I can send messages, receive messages, send photographs if I need to about a certain concern. Virtual care is part of a care delivery system that is becoming more common, and I think that's a really positive thing. But it's one aspect of care. And I've heard many people say they're looking forward to the time when they don't have to say virtual care, that it's just part of healthcare. It's one option. For me as a patient, having some choice and making sure that the way in which I interact with my care team is specific to many factors makes sense. So if I am at home and I'm worried about safety, especially during the pandemic, having a virtual care option gives me greater access to care in a safe way. It also prevents perhaps people in an office where a family health team would normally operate to have safety for them as well. So to me, virtual care really creates an opportunity to expand healthcare services, expand patient choice, and if it fits well with the problem you're hoping to get help with, then it all makes sense.
What I would say to encourage my colleagues or other healthcare providers to encourage them to use virtual care is that virtual care has been proved to work and has been proved to achieve outcomes that are similar to in-person visits. In addition to that, it brings patients a better experience because patient can be assessed from home with the company of their families. And in addition to that, over time, the experience that the patients are having has been great. I have no complaints so far regarding virtual care. And in fact, a couple of my patients, they're asking for a virtual care visit instead of driving and coming to the hospital. So if you're not doing that for you, do it for your patients, to support your patient for a better care.
Patient safety happens every time there's an interaction between a patient and their care provider. So every interaction needs to ensure that safety is present. And recognizing it with an annual week, I think, is important to raise awareness and to let people know that that's happening in their system, whether they think about it or not. But the important thing is that patients are involved with their care providers each and every day, each and every interaction. That's quality care.